My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California, and want to welcome you to this evening's webinar, Got Diagnosis, Women with Bleeding Disorders, which is part of our Public Policy and Advocacy webinar series. So just getting started with a few housekeeping items. First of all, we want to say thank you to our sponsors. Takeda is our platinum sponsor, and then bronze sponsors, BioMarin, Novo Nordisk, Sanofi, Bayer, the Hemophilia Alliance, and AbbVie for supporting the webinar series. We're going to be talking about the difficulty that many women have getting a diagnosis, and I'm sure that some of you have those stories, and I would feel free to share that if you're comfortable in the chat. Want to also remind you that the Hemophilia Council of California and our speakers today are not providing legal counsel or medical advice. And I think that's especially important on a topic that we're discussing today. None of our speakers are physicians. And even if we were physicians, we really would not be able to speak to your individual situation, diagnosis, or treatment in a dialogue that we would have, over a webinar. That's a individual conversation that you would need to have with the provider. So the experiences that individuals share are their experiences, and they may be instructive to you in your own medical journey, but we just want you to understand that it is not medical advice. For tonight's webinar, what is the problem that we are talking about? We are talking about barriers that women in particular, and to some degree all patients that have potentially more mild bleeding disorders face in getting accurate diagnosis. And there's a number of factors at play. Some of the most common ones that I hear about are, there is just systematic bias, right? So there is bias in the medical system that we are becoming more and more aware of that sometimes works against people accessing proper diagnosis and treatment. And that is true not just in bleeding disorders, right? That can be true across other types of illnesses and that patients may face. There is also a difficulty recognizing and defining excessive bleeding. And I think one of the challenges with that is that men and women don't necessarily bleed the same way, right? So physicians who have been within the bleeding disorders community treating men who bleed have a certain expectation of what that's going to look like, and it may not look the same for women. And then also, it can be difficult to measure, right? When we're having a bleeding episode, it's not like we're actually, the bleeding isn't coming out of our body into a container that we can collect and measure how much it is, right? And so it can be difficult to really quantify what that looks like. Again, similar to what we've said, it doesn't always look like the textbook, especially for women. It doesn't look like what the doctors have studied in school. And then the last point, sometimes we have a great deal of difficulty being referred to the right type of hematologist. And what do I mean by that? Well, what I mean by that is that in hematology, there are really, in its broadest sense, sort of two classifications, right? There is benign hematology, which is non-cancerous types of blood disorders. And then there is what really the vast majority of hematologists practice, which is more treatment of disorders like leukemia, like blood cancers, right? And so if we get referred to a hematologist, maybe because of our doctor or because of our insurance that isn't familiar with bleeding disorders, they may be less likely to get us an accurate diagnosis. Okay, so briefly, like if you are struggling and you're like, okay, I think I might have a bleeding disorder, who are you going to try to go to for help, right? So there's kind of three primary types of physicians that you might see. Initially, you might see your primary care doctor or your PCP, primary care provider, and or an OBGYN, because of course for women, oftentimes, but not always, a lot of our bleeding issues kind of have to do with the bleeding that we do during our periods and our monthly cycles, right? And so it might be something that comes up with an OBGYN. You might have had someone might have had difficulty during childbirth with hemorrhaging or bleeding. And again, might be something that our OBGYN observes. Some of whom are better than others at understanding the potential of a bleeding disorder and its impact on what's happening with our bleeding. Sometimes, unfortunately, an OBGYN just doesn't have the specialization or understanding of a bleeding disorder. And so it may not be the first thing they think of, may not even be the second or third thing that they think of in order to offer a referral. And then lastly, really where you want to end up if you think that you have a bleeding disorder is with a hematologist that has expertise in bleeding disorders. So as we were talking about, a hematologist who specializes in benign hematology and really has some expertise. Quite often, the best place to find that individual is going to be at a hemophilia treatment center, but not necessarily always. And sometimes because of your insurance, you may have difficulty accessing a hemophilia treatment center. Okay, just a few points here as we dive in a little bit more on testing. So I recently got to see a presentation by Dr. Johnson at HFA, and a couple of points that I have here I'm really borrowing from her excellent presentation. And she talked about how ideally all potential carriers should undergo genetic testing to confirm a diagnosis of hemophilia, and that would apply, I would say, to all bleeding disorders, and establish causative mutation. So really any family history of a bleeding disorder is a reason for genetic testing. And anytime that bleeding is impacting daily life and activities, it should be investigated. And a really important point with that is that when bleeding, the definition of how your bleeding is impacting your daily life is not, oftentimes we make sort of adjustments, right? Like we adjust our lifestyle around the bleeding that we're experiencing. If we're having to make those adjustments, then that bleeding is impacting our daily life. And it's something that we should be investigating and seeing if there is treatment available to assist us. Types of testing to consider. So we could do an hour probably on each of these topics easily, and I don't unfortunately have the time tonight to dive into them, and really would want a physician to be able to really go into this, right? But when you're investigating and trying to get a diagnosis, there's a few different types of testing that may or may not be offered to you, or that you may want to ask about. Genetic testing is going to be the most definitive, right? That is going to be the most definitive way to determine whether or not you actually carry the gene and are therefore potentially experiencing a bleeding disorder. Factor levels are another, so the blood factor levels is another way that physicians can investigate whether or not you may have a bleeding disorder. And then typically PK studies, so that has to do with if you're on treatment, how that treatment's working for you, how your body is metabolizing the treatment that they're giving you, and how long it's lasting in your body, right? So that's going to be further down the road, less likely to occur at the beginning of your journey towards diagnosis.
All right. Well, thank you everyone for joining us tonight. Please feel free again to use the email or the phone number to reach out to us if we can assist you. Thank you for coming tonight.